Hey guys, how you
Hey,
doing?
Hi
Good to
Omar,
see
hi
you.
Omar.
you
Good
too.
to see you too.
Today we're going to talk about mental health. Last time we talked a bit about how we think that the development of digital health solutions in mental health and kind of the upcoming or more I would say adopted and accepted category in the Western world and in some of the developing markets, how that maybe is influencing the Middle East and our local markets in the region. How it relates to the stigma of mental health and how we view it. Is it taboo? Is digital health kind of a new solution for that? So, I think we should talk about that today. Yara, why don't you give us some perspective from the public health view of mental health in the region?
Sure. So I think mostly globally, like the WHO says that there is one in every 10 people worldwide suffers from a mental health problem. So that's almost like 10% of the world population that suffers from mental health problem. And yet there's only 1% of the healthcare workforce who actually do work in mental health. So, but mental health in generally is a part that is not only has stigma, so people don't necessarily seek help or want to admit that they have help, but mostly also underfunded. So a lot of the mental health is either self-funded or not funded at all. And then this is even worse and worse in low and middle income countries because they think they have other priorities of physical health better than mental health. And the link between physical health and mental health is kind of not still established within the healthcare systems to be able to fund it. So you have more than like 80% of people in low and middle income countries who actually suffer from mental health problems and they know undiagnosed do not receive the help that they have. And within the region, numbers vary a lot and also a lot is undiagnosed and we don't know the real numbers of like depression and anxiety, schizophrenia, because there isn't really a specific systematic way of collecting the data and reporting on it. It's what I can say is that it's a lot. And specifically in the region where we have crisis, so Iraq, Palestine, all Syria, all like the fragile states, and recently Lebanon, the link between mental health and like fragile states or like situations of crisis is really established. Yet we still have no way of knowing or a systemic way of collecting data, knowing what's going on. So yeah, that would be my take on it.
Omar, what do you think about the situation with mental health in the region? And, is digital health a, way to solve some of these issues that Yara has brought up and, opportunities in the future to help improve the mental health challenges?
Yeah, I'm a wholehearted believer in the power of digital health with like mental disorders in general. Uh, if we look at regionally, the opportunity is massive because of all the reasons that Tiara just said. So there there are a lot of people that need it, and there's a huge population in the region, and there are we were talking about the stigma, and I think it's a huge barrier in terms of like it kind of creates a barrier between you and society too if you're like someone that goes to a therapist or goes to a shrink. So I think digital provides that anonymous way to connect with someone really quickly, connect with them from the comfort of your own home. You don't have to tell anyone where they're going or where they're coming from. It's a big cultural issue, I think, that we have in the region. And also, if you're looking at the global front, mental health startups have been raising crazy amounts of money. If you look at the amount of investments that have gone into digital health, especially over the 2020 and 2021, like the COVID years, I guess, not just 1 year anymore. There's most of the companies that have done well in raising funds were gearing towards that. And then when we look at the specifically, again, digital therapeutics, I'll come back to that because I'm fascinated by this specific branch of digital health, and I think it's going to become its own thing. but there's a lot of evidence that companies are starting to show that if you use an app with a therapist, you get benefits way more than CBT therapy alone or seeing a therapist alone, because there's also all these added features of community support, which I think is huge when it comes to dealing with mental health. And then data where you're able to measure certain things like EEG, or there are all these like wearables too that you can connect to have like a complete picture about the mental health of a person. And there's this band that that can visualize all your brain waves while you're meditating to show you improvements. So all these like added layers, I think, create like a mental health service that's better than what we normally think of it. And also like this idea of, if I know you better, then I can maybe connect you to a more relevant therapist. So that's my stance. I really think it's coming. I think there's no reason for it not to come. Except accessibility, which I'm sure Yora will have something to say about. And then also what I will close off with is that I have myself have been doing online therapy for the past few years, and I've only met my therapist once, and wherever I go in the world, I can still talk to that person that I found a lot of comfort and relatability to. So it's it works for me personally, and it's certainly working for the VCs. So I think it's natural for it to come for the region.
Yeah, I mean, I think to Yoda's point about the ability for it to have an impact. I kind of look at it from the overall benefit of services in mental health and how that relates to the market in general, beyond just the person's health. And I think for me, all of these ideas around wearables and therapeutics and methodologies and different solutions still require a tremendous amount of investment, like you said, with VCs and other money. But who's the actual consumer, right? And is it a patient who till today primarily is a self-funded payer of his healthcare services, responsible for also taking care of his mental health? Or, in my opinion, it should be the private sector. I think it should be the corporations and the companies and the insurance providers that these companies use that should build that into their benefits as a, mandatory piece of, making sure their staff and their personnel stay as optimally mentally kind of capable of doing their job. Because I think a big reason that most people go through mental health issues is because of their job, right? I mean, making money, dealing with the stress of the work week and kind of the pressures of what you have to do. Now, again, that might be more of a white collar versus blue collar kind of scenario, but at the end of the day, there's services and solutions that are out now that only the white collars can afford. So it needs to be maybe deployed and tested through that. Again, to me, it's still a very wide area of, many different challenges and many different, ways to try to come up with solutions. So I'm still eager to see the new solutions that are going to continue to come out. But I still think it's the private sector that should bear most of the cost.
Yeah, it's a really good point that you bring up too, that where does the stress come from? And what is the source of our pain, And when we think of jobs that we might be entrenched in, or structural issues, like Yara was talking about crises, right? Like structural issues. How much can an individual intervention help when you're going through war, or you're going through a job that you really hate and your boss is just driving you crazy and you're burning out all the time? So that's a big question, I think.
Yeah, so that relates a lot to the stress and anxiety, which are the pandemic, on top of the pandemic that we're having. We kind of need to remember the other types of also mental health issues, so schizophrenia, bipolar disorders, things that could be triggered by stress, but also has a lot of genetic factors, or we don't need to go into that, but things that doesn't only relate to your well-being, like stress and anxiety, but things that could be more tougher to solve. But I think in and I'm sure you'll touch on that, yeah, Omar Shaker, with digital therapeutics part and how it is being used, and it's like the biggest use case to look at schizophrenia now and dementia with the digital therapeutics. But I think one of the interesting things that could be used and being used in different places, but not in the Middle East, which is the use of AI to to analyze the data coming from the SMS messages and from the social media to understand the levels of different mental health issues. And in different situations, AI models has been used to predict the first depressive episode of a person, just like by analyzing their digital footprint. It takes us to a lot of like data security issues and privacy, and to what extent could we use like the digital footprint of certain of individuals. But this is also, I think, is a very good use case, considering that we don't have a systemic way of understanding who has or who is suffering from mental health issues and how can we intervene early on.
That to me is again a very important point, and to what was discussed earlier around data and understanding really the actual mental health situation. I think that an effort to really organize or categorize or segment the populations and how mental health is really impacting those different segments of the population will uncover kind of some maybe low-hanging fruit or priority areas that investment can go towards, so that there's hopefully beyond that some influence, some trickle down, some kind of effect that helps solve some of those other challenges in some of those other areas of population that maybe right up front is just too difficult. I mean, when you talk about war zones and trying to provide mental health to people in war zones, I mean, that's a pretty heavy challenge to try to figure out solutions around. Whereas maybe again around certain corporate employee personnel and a program where some of again similar. I'm not a mental health expert, but I'm sure that there is some, similarities within depression and anxiety that can then be taken on in a different form of, therapy and diagnosis and treatment to other patients. It just, again, it needs to start somewhere, right? And I think that that's really who's got the money to spend it. It's the profitable companies that are pushing their employees, to the max, and that's where we can get things going.
So where do you think the challenges lie in providing digital health solutions in our region?
I think adoption. I mean, if you're asking me, I think still like the number one, challenge is always adoption and getting people to use a service or use a solution and actually get data to prove that it works, right? So, how do you implement more effective adoption is the challenge, I would say, with some of the new models that have come out in the region and their ability to really prove, the opportunity to solve those mental health challenges for those patients.
I do agree with you. I think one of the biggest problem is that even if people seek mental health services, it's just way too expensive. It's not covered by insurance, and it's way too expensive to be provided out of pocket.
I agree with both of you. Yeah, I think structural issues, especially when it comes to poverty and war, are really hard, just tough challenges. Not to say that they're not solvable. I think they're completely solvable, at least maybe on the long run. But it's really hard to help people heal from these things in the way we expect to receive a service with digital health these days. So do we think that digital mental health is gonna keep on growing and is gonna become a thing in the region, in spite of all these big challenges that we know? I still say yes.
I say no.
I say that it's gonna take a seat for a bit. I think that there will be some attention towards it and some investment and some early stage trials and pilots and models, but I think that there's still other more significant healthcare challenges that are going to still need to be addressed, that, more of the investment, more of the attention is going to go towards. And I think that the stigma over time still needs to get, resolved, and is going to inhibit some of that, early stage mental health adoption.
What about all the startups that we know are already like working in this area and have raised funds? There are a lot that are doing great work, like Shezlong and O7, Takestep. Are they too early? Are they too early, or are they on point?
No. I think they are on point. I think Shezlong and O7 are providing a marketplace to connect people to doctors, to therapists, looking at different segments of society and with different pricing models. They are delivering the physical service online, which I think is in the right time to be delivered. However, my main concern is with the startups trying to provide, wouldn't say more sophisticated digital mental health services. So not only a marketplace, but more looking at using AI to identify certain issues, or
provide the service themselves.
Providing some sort of, providing the services themselves. Exactly. Yeah.
I think that's a great point. Yeah. All right. Well, what are we going to talk about next time?
Yeah.
نتكلم في ايه؟
Did we talk about women already?
Women?
Yeah.
Oh.
Women's health.
Women's health.
All right. Hot topic.
It's a good one.
We didn't talk about that already, right? No.
I don't think so.
Well, we certainly dabbled last episode. But yeah.
You had a perspective, Yara, on it.
We had a perspective.
And brought it as kind of, a focus area, but I think it could be a topic for sure.
Yeah. All right. So next time, let's go.
All right, great. Good to see you guys. Talk soon. Bye.